Thank you all for coming today. I'm Sandra Luscombe. I'm a developmental pediatrician and a child protection physician at the Janeway. And joining me at the table is Julia Trahey, who is the clinical chief of patient safety and a general internist at the Health Sciences Center, and Bridget Fernandez, who is a medical geneticist and the medical director of the provincial genetics program. In the room, we have a number of other physicians who are joining us in our current dealings with our positions at Eastern Health, and that would be Dr. Mohammed Alam, pediatric neurologist, Dr. Rick Cooper, pediatrician, Laura Vivian, pediatrician at the Janeway, and Angela Penny, general adult psychiatrist, as well as Amy Tong, general internist at the Health Science Center. And I'm going to pass it over now to Bridget to explain what has been happening over the last 12 hours or so.
So I wanted to thank you all for coming and thank the NLMA for helping us organize this press conference. We did it in response. We've received dozens of inquiries from the media starting sort of late last night, and we thought this would be the best way of clarifying for you why we have made this political statement. So this morning, a group of 13 salaried specialists submitted letters of resignation to 2 health authorities. There are 12 of us that resigned to the Eastern Health Authority, and one person, Jim Scott, a neurologist, who's resigned to Western Health. And the reason that we did this is because since 2008 in our province there has existed a 2-tiered salary system for medical specialists. And currently we have 60 physicians who are cancer specialists and laboratory medicine specialists that are paid on a higher scale, and 120 other salaried specialists, and we represent that group, that are paid at a significantly lower scale. So our position on this is that we are equally trained specialists, that everyone's got a minimum of 4 years of training after medical school, some people up to 7 or 8 years of additional training, that we're doing equal work, and that we feel we should have an equal wage. The patient populations are all slightly different, but we felt that we should do this to really stand up for our patients and to make the point that no one category of patient should be more important in this province than another, that cancer patients are very, very important, as are those with mental illness, as are children, as are people with intellectual disabilities who have genetics problems, and as we saw how negotiations were going, we realized that this was not going to be recognized. And I just wanted to make the point that members of our group have, we thought initially that the government might not be aware of some of the workforce issues or the work shortages we were facing in our particular areas. And going as far back as 2008, various individuals from this group have been meeting with government, and we believe that they are fully aware of the challenges that we face vis-a-vis unfilled positions, long wait times, and a very unstable workforce.
And I would just echo what Bridget has said, because initially my reaction was, well, it must be a matter of education, because they must not understand the circumstances that we're working under, the challenges that we're facing, the difficulty we're having with recruiting. And if that's the case, that there would be an effort put into education. And so, independently and with the NLMA over the last 2 years, we've been trying to explain what the current circumstances are with delivering our health services, and we just were met with the same response over and over again. And so at a certain point, and that point has come certainly over the last 3 or 4 months, the growing realization that despite our efforts on an educational front, that we were making really no headway. And so at that point, it was like, well, we have only a couple of options: to continue on in a system where we know that we have not been making gains in many of our areas, and knowing that the current offer from the government is inadequate to address those challenges. And so we say, well, we can stay, but things are not going to change. We know that. Or what else do we do? And so when you're faced with increasing demands on your time, increasing demands on your expertise, and feeling increasingly that you can't meet them, then at some point you have to say, well, what decision am I going to make? And the decision was that at this point I can't continue on in this system. And I think we all kind of came to that realization, and it's not an easy decision. We make these decisions for personal reasons, individual personal reasons, and for some of us at great personal cost. And so I think that needs to be clear, that we fought to stay.
And I'll just add that none of the 13 expect to personally benefit from anything that's going to come out of these negotiations subsequently. We've sort of made the commitment now that we'll be leaving. But we do feel, so you might ask, well, why didn't you just leave and why do it as a group? But we thought, well, at least if we do it this way, the system will have to recognize the deficits, and that for the next wave of people coming in to fill our positions, they'll be paid a competitive salary, and the workforce should be able to recover.
We felt that in making the decision to leave, that obviously our patients would be impacted, but doing nothing was not going to help our patients. And we felt that by tendering a resignation with 3 months' notice, at least this would give our patients time to meet with us and have a plan for what would happen after we were gone, but we certainly do. One of our largest concerns is, of course, the ongoing care of our patients, and we're glad that we will have some time to be able to put some of that in order before we leave our positions.
So just quickly, I want to go back to what Bridget Fernandez just said. You're not expecting to benefit from anything that will happen after this. So does this mean this is final? Like if the government comes back with Atlantic parity, does it matter? The 13 physicians who have resigned, that's it, you're gone?
In the current offer that the government has made, they have actually offered us 98% of Atlantic parity, but that's not, of course, parity to the internal, is not internal parity to our colleagues who 18 months ago were making the same base salary as us. So they have offered 98% of Atlantic parity, but they have actually linked that to a new incentive that they are starting called shadow billing, so that we would bill like a fee-for-service person, and we would then get a percentage of this increase. So even with the current offer on the table, we're not sure what our salary would be at the end of the day. So to clarify that, and then to answer the gist of what your question was, is that yes, we are resigning to resign and leave. Some of us have already made some plans in that direction. Others of us are taking some time. This has been an extremely demoralizing and difficult road over the last number of months. I think working in a system that you feel doesn't always listen to you when you're trying to advocate for your parents, for your patients, and your patients' parents in my case, because I am a pediatrician. It is very draining, and I think some of us actually will be taking some time probably away from medicine to reflect on what our future will be. But no, everyone, all 13 of us have no illusions that this was somehow going to change everything for us. We've made our decision, and we hope that this has some impact on the stability of the workforce after us. So this is not.
And I can say
this is not a job action. We have resigned.